So we're going to run through where all the muscles are in this trunk or back region. So firstly, it's important to notice that we're looking at two different levels of muscle. This is more superficial, this is one layer down. I know that because I can see the bony outlines of the scapula. This here is the scapular spine we can see there. It's not present on this side because it lies underneath this muscle. So this big muscle, this like triangular type shape with the three distinct sections is the trapezius. The top section, when it activates, if this gets shorter, the shoulder actually elevates. The middle section, if this section of muscle here gets shorter, the shoulder pulls back or retracts. And the lower section of the trapezius, if this contracts and gets shorter, then the shoulder depresses. So as you can see by that, the trapezius has got a lot of different actions. It's going up, it's coming back, and it's going down, all because of that sort of triangular or diamond type shape. The fourth action of the trapezius is upward rotation of the scapula. And that's because this superior section of the trapezius connects to the upper border of the scapula. So when that contracts, the actual scapula sort of wings out to the side. And that'll happen often when you abduct your arm. If we go a layer deeper than that, we've got a synergist in shoulder elevation. And that's the Levator Scapulae. So it's connecting right up here at the top. It gets shorter, it also raises your shoulder or elevates your shoulder. We've got the rhomboid major and the rhomboid minor, which are the prime movers in shoulder retraction. So when this muscle activates, it's going from your thoracic vertebrae to the border of your scapula, bringing your scapula closer to your vertebrae, so setting your shoulders back. Running down along the, right down the back, you've got three muscle columns of the Erector Spinae. Now these are the prime movers in trunk extension. And we can't see a clear image of the three muscle columns in this particular model, but the three columns are the iliocostalis, longissimus, and spinalis. So three layers from the most lateral into the most medial. We can also see underneath the arm, so the big muscle that wraps underneath the arm is called the Latissimus Dorsi. Latissimus Dorsi connecting from your vertebrae, wrapping all the way up to the front of your humerus or the anterior humerus. As we rotate the trunk around, we see a muscle that lies across the side or on top of your ribs. This muscle here is called the Serratus Anterior. Now it's actually connected, it's connected to or inserts into the underside of the scapula. So when this muscle contracts, it draws your scapula forward, which protracts your whole shoulder. Often the nickname for the Serratus Anterior is called the boxer's muscle, because this is the main muscle which is used when punching someone, if you're protracting that shoulder forward. The Pectoralis Major is this big muscle in the front part of your body. Pectoralis Major has an origin of both the clavicle, the sternum, and also the ribs 1 to 6. This also connects on the anterior section of your humerus, right where your Latissimus Dorsi connects. One's right next to the other. So this will play a role in the prime mover for shoulder flexion. It'll also play a role in adduction, which is bringing your shoulder back down by your side, bring your arm by your side. And because it's attached to the front of the humerus, it's also going to medially rotate your shoulder. So the interesting point here is when some people try to sort of even out the muscles in their chest and back, they'll have a tendency to work both the Pectoralis Major and the Latissimus Dorsi. But as they both attach to the anterior humerus, they're both going to work to medially rotate your shoulder and really have that person hunching over. The way to combat that is work muscles like the rhomboids, which will help to retract your shoulders and set them back. On the other side of the body, because we're one layer deeper, we've got the Pectoralis Minor. As you can see, the Pectoralis Minor up here actually attaches to the coracoid process, not to your humerus. So it plays a lesser role in actually in doing anything with your actual humerus.